Hello friends, welcome back to Complete Medical Coding. Today let's discuss few coding guidelines. Okay, I'm here with some general coding guidelines. So, because I'm focusing on my channel for especially for the freshers or those who are preparing for the examination. So, I'll be back with more questions, practice questions, as well as guidelines. I'll be doing all this in between. So, which will be useful for the beginners, those who are into the medical coding channel, into the medical coding field. All right. So, today let's discuss the coding guidelines. Okay. So, let's go to the video. What are the general coding guidelines for CPC examination? The main important guidelines is the one which we are talking about today. Always code to the highest level of specificity. You have to always code to the highest specificity, highest level of specificity. As you all know, on ICD, we are talking about ICD, okay? ICD is a 7 characters, right? Alphanumeric characters. So in that, highest level of specificity means usually the first 3 characters are mandatory for ICD code, right? So from 4th to 7th, like 4th, 5, 6, 7, all these are, it's not mandatory code, but in order to make it specified, in order to get a confirm in order to get a perfect, accurate diagnosis, sometimes yes, you have to code 4th, 5th, 5th, 6th, 7th characters. So always use those characters whenever required, or if it is needed, or if it is there, if it is present, or if you can code that specific up to that specific level. If you can code, it will be better. It will be great. Okay. So that's what highest level of specificity means. If there is any 4th, 5th or 7th character present, you should definitely code it. Now, sequence diagnosis codes correctly. You have to follow the sequencing for the diagnosis codes, which means principal diagnosis are the first listed diagnosis, right? So principal diagnosis, it should be the main important diagnosis, which should code first, followed by the secondary conditions. So the patient is here to treat what? It should be the accurate principal diagnosis. Okay. Now, never code rule out suspected or probable in outpatient setting. You should use confirmed signs or symptoms instead. So if a patient is here, or if the patient is suspecting this disease, or in order to rule out this disease, you should not code all those. Only you have to code the confirmed diagnosis. You should not code, for example, this patient is suspected to be pneumonia, or the doctor is suspecting the patient to be pneumonia, or the doctor is ruling out. The doctor is putting some test in order to rule out pneumonia. In that case, you should not code pneumonia. Only if it is confirmed, you have to code it. Okay. So, if there is no such confirmed diagnosis, you have to code only the signs and symptoms which are present in the R codes, which should be taken from the R codes. Okay. Now, bundling and unbundling. Don't code separately for services that are bundled in another CPT. As you all know, bundling, there are few CPT codes, especially it comes in panels. It will be, there will be some common test in both the panels. So in that case, you should never code both the panels together. Examples are renal function test and liver function test. Okay, you should not code these 2 panels together. Like that, you will get so many different services, CPT codes, which are bundled. Another one, you can say, some minor procedure, for example, minor dressing. It is already included in the E&M setting, in the outpatient visit. So you should not code it separately. So like that, going forward, you will be getting, there are more and more CPT codes which are bundling. Same like that, unbundling. Okay. Like some panels, if you are you are building or you are coding one panel as well as the test separately. That's unbundling. That is also not allowed. Now, modifiers. Use them appropriately to indicate laterality, multiple procedures, professional and technical components. The proper use of modifiers is important for coding during the coding. Okay. Now, E&M guidelines, evaluation and management guidelines. What are the important E&M guidelines? See, on 2021, E&M guidelines have been changed. So, 2021 plus from 2021 onwards, office or outpatient E&M codes, and these are the ranges, 99202 to 99215. Okay, they are selected based on the MDM and time, not history or problem-focused examination. Initially, like before 2021, all these the key components were present: history, examination, medical decision making, and time. But now, since 2021, you have to focus only on the medical decision making or time. Okay. Emergency department visits 99281 to 99285 do not require new versus established distinction. Yeah. On emergency department cases, you should not distinguish the patient between new and established. Both are same. There is no different codes for new patient or established patient in emergency visits. Okay. Critical care codes. Critical care codes are 99291 and 99292. It requires documentation of total critical care time. So critical care codes always you should mark according to the critical code time. Preventive visits. Okay, these are the codes based on age and whether new or established. Yeah, age. Preventive visits, preventive medicine codes. In those, you have to always calculate according to the age. Also, whether the patient is new or established. Accordingly, you have to calculate. All right, you have to code it. Now, which are the surgical package guidelines? If you are coding a surgery, so what are the main guidelines for coding surgical package? The global surgical package includes pre-OP visits. Pre-OP visits means the day before or the day of. Pre-OP, pre-operative period, before the operation, before the surgery. So, a day before the surgery or whenever the day before the surgery. That is pre-OP visits, all the pre-OP visits. Intra-OP visits, post-OP care, all these are included in global surgical package. If you are coding some global surgery code, all these are included. Pre-OP visits, intra-OP services, as well as post-OP care. Everything is included. Okay, post-OP care in the sense typical follow-up in the global period. So you should not have to code pre-OP separately, intra-OP services separately, and post-OP. No, that is wrong. For global surgical package, all these are included. It will be a single code, single surgical code. Okay, IP code. Now, don't separately bill for routine post-OP care unless unrelated complication. Yeah, same as I told you. It is included in the global surgical package. So you should not bill separately. You should not code separately for the post-OP care, routine post-OP care. If there are complications, yes, you can bill it. You can code it separately. But if there are no such complication, then always don't bill separately for routine post-OP care. Use modifier 24 for unrelated E&M visit. Okay. 24 is the modifier used for unrelated E&M visit during post-OP global period. 58 modifier is for staged or procedures during the post-OP period. 78 modifier is for return to operating room for a related procedure during the global period. Some related procedure. For that, if the patient is returning back to the operating room, you should use modifier 78. Now, you should use modifier 79 for unrelated procedure. Okay, during the global period. These are just common examples. Now, what are anesthesia guidelines? Report anesthesia services with anesthesia CPT codes. Which are the CPT codes? 001, 002, 01999. These are the anesthesia services with anesthesia CPT codes. Okay. Always include qualifying circumstances 99100 to 99140 if applicable. So if in the question, if anything mentioned about the qualifying circumstances, you should use these are the codes for the qualifying circumstances 99100 to 99140. Okay. So I had already taken separate chapter for anesthesia. I'll be taking it, again and again. I'll be taking it like I'll be coming back in detail with that. But these are the general guidelines. Okay. Now time. For anesthesia, when coding, time is important. Okay. Start when provider begins to prepare. So how to calculate the anesthesia time? Anesthesia time is always calculated by, it begins when the doctor begins to prepare the patient for anesthesia, and stop when the patient is safely turned over to PSU. So anesthesia time is calculated by from the time the patient is being prepared for anesthesia till the patient is being sent to the recovery. So that time period is the anesthesia time period. Okay, it's not about anesthesia starting and ending. No, it's about the patient which is being prepared for anesthesia till the patient is being sent to recovery. Now, physical status modifiers. These are another important anesthesia modifiers, P1 to P6. It must be added whenever necessary. Same like qualifying circumstances. Okay. Now, radiology and pathology. Some guidelines from radiology and pathology. So, for radiology CPT boards, it often needs modifiers. Two modifiers are commonly used. One is professional component and another one is technical component. 26 is a professional component, whereas TC is a technical component. So, use accordingly. If both professional and technical are performed, you can report it without a modifier. Okay. Now, for pathology or lab, some tests are bundled. Yeah, as I told you earlier, some tests are bundled. You should not code it separately. Yeah, so but for pathology or lab, pathology, that is lab, you have to code you have to always take care of the bundled codes. Okay. Panels example 80053 must be like comprehensive panels. All comprehensive panels should be taken care. Okay, it must be built as a panel code if all the tests in the panel are performed. Yeah, that is unbundling. So if for example there is an electrolyte panel. I'm just saying an example. Electrolyte panel, and the doctor is performing all the electrolytes in the electrolyte panel, like sodium, chloride, potassium, everything. But you are coding it as separately. That is unbundling. That is not allowed. So basically, if in a panel, if all the tests are performed, you have to code the panel only. But don't code two panels containing the same test together. Okay, that is what bundling and unbundling is. Now, ICD and coding guidelines. In ICD, initially also I have told about the 7 characters coding guidelines. Now here, few more. Code signs or symptoms only if no definitive diagnosis is made. Yeah. You have to code. This also I had mentioned in the first slide. You have to code signs and symptoms only if there is no confirmed diagnosis. Now, for chronic diseases, examples diabetes or hypertension, assume ongoing condition unless stated resolved. Okay. So, ongoing condition has to be coded unless it is resolved. For chronic conditions like diabetes, if you take diabetes, you will get a lot of codes that comes under diabetes. You will get lots of codes that comes under hypertension. So, you have to specifically find out which code is the exact code, accurate code. Like for example, hypertension with chronic kidney disease, or diabetes, type 1 diabetes, type 2 diabetes, something which will be related. So according to the documentation, you have to find out what needs to be, what is the exact code, accurate code. Okay. Now use combination codes when available. For example, DM with neuropathy. Yeah, same as I said now. DM, diabetes with neuropathy. If there is any specific code that contains the combination code, then you have to always use the combination code. Don't code it separately. Okay. Now for sequelae or late effects, sequela, otherwise called as late effects, you have to code the residual condition first, then sequela code. Yeah. For sequela codes, you have to always code the condition, residual condition first, then followed by the sequela code. Now external cause of injuries. The codes that starts with V, W, X and Y. These are the external cause of codes of injuries. External cause codes. All these codes should never be primary. You should not code these external codes of injuries as primary. Okay. Yeah, so that's it, friends. That's it for today. These are some important guidelines, some common general guidelines which I had taken, which I thought that it might be useful. Yes, of course, it will be useful for the uh, beginners or those who are preparing for the examination. All right. So please go through my video. If you find this video useful, please like and share it among your friends. I'll be coming back again and again with practice questions, more questions. Especially I'm focusing on the students, those who are preparing for the examination. So I'll be coming back again with practice questions in the next episode. In between, I'll be doing the guidelines as well. So if you particularly need any topic, you can please mark it in the comments, and I'll be doing that specific topic in the upcoming videos. Okay, so please stay tuned, and I am really apologizing for not putting videos for few days because of some health issues. So apologies for that, and I'm trying my best to put more and more videos in the upcoming days. Okay, so please stay tuned and please support me as always. So thank you so much, friends, for all your support. If you are new to the channel, please don't forget to subscribe. So thank you, friends, and take care. Bye. See you.